We're going to review the SFMA and how we utilize it here at DPT, meaning that we're going to add in a couple little extra parts and screens to make sure that we can get the most out of our initial assessment. So for the SFMA, it's a top to bottom screen, that selective functional movement assessment. You can go through the neck, shoulders, multi-segmental rotations, and movements about the spine, single leg stance, and overhead deep squat. Let's talk about the movement criteria and even the grading scale. So basic grading scale is going to be that FN, DN, FP, FN kind of scoring. So the FN is functional non-painful, FP is functional painful. So functional meaning it meets all the criteria. Then there's the DN, which is dysfunctional non-painful. So they are limited in their range of motion or their abilities, but it's non-painful. Or DP, which is that dysfunctional painful. So those are 4 easy ways to kind of categorize this. We can also put into our basic orthopedic testing and range of motion, but that's kind of another layer to add in. Usually after we do the SFMA, we can then get a little bit more micro on it. All right, so we're going to start by getting Elijah to stand here with both feet kind of just underneath his hips and maybe even a little closer together. Get him stand up nice and tall. What I'll normally do is go ahead and use this as an opportunity just to check out people's basic posture. And so like, all right, how is he standing? Like, you know, how, like, kind of run my fingers down their back and along their spine. Hey, how does this look? And like, how is it feeling? You know, where do they tend to just line up and how are they put together as a human? Okay. Elijah, I'm actually going to have you turn. Why don't you turn and face me this way? And so typically what I'll do is we're going to start up at the neck. I'm going to say, Elijah, I want you to go ahead and keeping your mouth closed. Can you look down like you're going to try to touch your chin down to your chest? So our criteria for this one is the chin actually touches the chest. His does really well. Do you have any pain there? Nope. No? Great. Good. Go ahead and look forward. Now go ahead and look up as far as you can. And what we're looking for here is, can he keep his mouth closed? Can he get essentially that forehead horizontal or parallel to the ground? Any pain or problems with that? Nope. Okay, bring it back to neutral. We're also looking for where does he hinge? Is there like one spot of movement? Does he deviate? Any of that stuff. So we're looking for some objective, just basic range of motion criteria, but then also qualitative. And then I'll say, Elijah, I want you to go ahead and look over your right side. So I'm going to even tap that shoulder just so he doesn't have to think. He's going to look over that right side. Ideally, we want that chin to go to the middle of that clavicle. He's a little short there. Any pain or problems there? Nope. Good. Same thing, I want you to go over to the left for me. Okay, and same thing, he's a little short, kind of coming across that first third of that clavicle, so he's a little short there. So he'd be DN for those. He'd be FN for his flexion. His extension was a little limited. He would be DN for that as well. Okay, next, to get into the shoulder, we would actually do this from behind. So Elijah, I'm going to have you turn and face the wall here so that the camera can see you better. In order to do this, this is going to be a hand behind head, hand behind back reach. The criteria is with a hand behind head is to be able to touch the top of this medial angle of the scapula on the opposite side. And then for the behind the back, we're looking for that inferior angle. So qualitatively, we're looking for how this stuff moves. I don't demo it from the front. I usually just tell people what I want and try to get them to move. So I'd say, Elijah, take this left hand and reach up and over your head and try to touch here. Good. And so he can do that. Do you have any pain or problems with that? Nope. Great. Take this hand, reach up and try to touch here. It's so much easier to do it this way. People don't have to think that way, and you're just telling them exactly what you want, and they just have to do it. So you're really trying to see that authentic movement. Great. No pain. Nope. Take this hand, reach behind your back, come up here and touch the bottom of your shoulder blade if you can. Great. Any problems there? Nope. Good. Same thing. Take this one, reach up, and can you touch there? Good. Any problems with that? While we're here, so those are all FN. That very first one, he shrugged up a little bit, but qualitatively, he was able to get there. Might give that a little DN, but I'm just being picky at that point. But overall, his shoulder blades both move pretty well. From here, what I'll also throw in, which isn't necessarily part of the SFMA, but I'd have him do a bilateral overhead and a bilateral abduction. So what I'll do is once you stand, I'm going to actually turn and face you this way, just quarter turn. I'll say, Elijah, I guess I just want to see the scapulothoracic rhythm. Elijah, go ahead and take both hands, reach all the way to the front for me. Great, and now finish up all the way overhead. And then bring them all the way back down. And I can just kind of check out and monitor what his scaps are doing. Do it again for me. That way we'll see if the rhythm's off anywhere, anything kicks out, there's any winging, whatever. Great, now take your arms, go out to the side like a T. And now all the way up and overhead. Great, and back down. One more time. Good, and back down. Okay, so they're moving pretty well. This left side tends to kick a little bit more, move a little bit more, so something to note. Also, as he came all the way up and overhead, since we didn't do like a formal flexion assessment, it was more of a combined motion assessment. Notice that he's a little limited there. So just some things to note, and we can get into the micro of it a little bit more later. Okay, Elijah, I'm gonna have you turn and face this, actually turn and face that way for me. All right, so for this next one, we're gonna start our multi-segmental spinal movements. So this first one is called multi-segmental flexion. We're gonna have the legs locked out. Why don't you bring your feet together for me? And for this, I always try to get profile. I'm usually standing behind the person to check out their shoulders, so then I'll always just step aside. I'll say, Elijah, with your legs straight, go ahead and I want you to reach down like you're gonna try to touch your toes. Go as far as you're comfortable moving. So Elijah can touch his toes. I'm looking here and trying to see if he has a nice, consistent symmetrical curve. Looks pretty good. Maybe a little bit extra here, but that's totally normal. But his low back does reverse curvature, so it went from that lordotic posture into that flexion. That's exactly what we're looking for. Any pain or problems there? Great. Go ahead and come up nice and slow. So something that would be, that'd be an FN. Something that would be a DN would be not going far enough, some sort of a shift or a rotation, something like that. We can, whether that's coming from poor motor control or tightness, we don't really know until we really break it out, but it's just worth noting. For the next one, we're gonna do multi-segmental extension. So Elijah, go ahead and put your arms up all the way overhead. Again, feet together. I want you to lean back as far as you feel comfortable going. Pretty good. Any problems with that? Good. So what we're looking for is, does he get that forward weight shift? And actually, I had one finger on his ASIS, and does it go forward of his toes? And does he get a nice symmetrical extension curvature? And do these, the inferior angle of his scapula go actually behind his heels? So do it for me one more time. And then multi-segmental extend. So again, forward, he does great. Back, he's actually a little bit more over his ankle than his heels. So, and if I just run my hands up here, he's not getting a lot of extension through here. So qualitatively, I'd give him a DN for that. Did you have any pain? Nope. Great. So if he had pain, we'd obviously have to put him in the painful category. He just has a little limitation here. And again, it's probably stiffness, but we'd have to really dive in and check that out. If that long lever with the arms overhead is too much, we can always have people do this with their hands on their hips or by their side and just see if that feels any different. But again, you can kind of see he's hinging here and this isn't really extending. So again, qualitatively, he's doing well. But, all right, so next, Elijah, for the camera, I'm gonna have you turn and face me. We're now gonna get into our multi-segmental rotations, so go ahead and put your feet together for me. So what we're gonna try to do here is the feet are gonna stay planted. I'm gonna have him rotate to one side as far as he feels like he can go. So what I would do is I would typically stand behind him. I'll get over here so you can see. Say, Elijah, go ahead and rotate to the left, and I might even just kind of lightly guide him with my fingertips just so his body knows where I want him to go. If I were to stand directly behind him, can I see this opposite shoulder? So in this case, his right shoulder. Can I see it from standing directly behind him? The answer is no, so that's part of the criteria. The other criteria is, does it look like he's moving through here? Are his hips and shoulders moving? Are his shoulders past his hips? What's he doing with his legs? It should look really comfortable, and it looks good, it just doesn't look like it's far enough. Go ahead and go to the right for me, and so same thing. Oh, so now we can see that opposite shoulder poking through. And he's not doing anything weird, like he's not extending. It looks pretty stacked. His hips are moving, his knees are moving, his ankles are moving a little bit. That looks pretty good. Any pain with that? Okay. So what I want you to do, so I would give him a FN going to the right and a DN going to the left. So we're getting into some asymmetries here. Show me what a funky one would look like, where you kind of try to extend a little too much or something like that starts happening. Or sometimes we'll even get like this kind of thing where the hips start to actually flex and people are trying to look behind them because they can't stay nice and tall and rotate. There's all kinds of things that happen. But again, that's the qualitative component of this, but the basic criteria is it looks like he's pivoting along an axis here, and can we get that shoulder all the way through, hips and shoulders moving. Okay, overall pretty good. While we're here, we might as well get into a little bit of a quadrant test. So I'd say go ahead, I want you to lean back and over your right side. So we're gonna kind of compress these low back vertebrae here a little bit. Any pain or problem with that? Nope. Same thing over here. And I just am guiding just to kind of tell his body it's like a featherweight touch. It's super light. And a lot of times I'll put my hand down here just so his body knows where I want that fulcrum to be. And it's really easy. Patients can just move right into it. And if it's painful, you'll know, because they'll go ahead and ask them and they'll tell you. Okay, go ahead and turn around and face the camera for me now. Cool. These are all our multi-segmental movements. Now we're going to get into our single leg stance. So what I want you to do for me, Elijah, if you can just stand there on one leg, eyes open, and go ahead and bring that foot off the ground. The old way of testing it was to bring the leg all the way up. Now they're just going to bring the foot off the ground. So whatever you're more comfortable with, we're just going to take a look and see, is he comfortable there? A little bit of movement in the foot, ankle, and hip is totally normal because your body's adjusting. But more or less, his belly button and his trunk should be nice and still. He should look like he's not stressed out. Great, go ahead and stay there. Go ahead and close your eyes. And so that searching for, or the maintenance of balance there is a little bit more challenged, but that's totally normal. Good, go ahead and go eyes open, feet down. What we're looking for is 10 seconds at a bare minimum for each of these. So eyes open 10 seconds, eyes closed 10 seconds. Normal is actually closer to 20, but for this purpose of the test, as they teach it, is about 10 seconds. It's usually plenty to get an idea about how somebody moves. Very common for the single leg stance with eyes open to be normal, and then as soon as they close their eyes, they put their foot down within a couple of seconds. That's challenging for a lot of our patients, especially in their 30s and above. Let's go to the other side. Let's go eyes open and stand on the right leg. Always very clear about eyes open or eyes closed because people will assume different things. Looking pretty solid there. Stay there. Eyes closed for me. Very good. So a little bit more wobble, but certainly nothing bad, like he wasn't falling over. Nothing like that. So again, I give him an FN for both of those. They look symmetrical. Maybe a little bit more wobble, but I'm not going to penalize him too much for that because he did maintain his base of support and his balance. Okay, the last test is that overhead deep squat. They used to teach it with the arms up overhead, so I still do it that way. They now teach it as if you're like going to pick something up from the ground. I like that upright because I want to see if they can keep their torso in a good position and at what point would their low back curve. Whereas I feel like if they go to reach down, yeah, it's a functional movement for people, but I'm going to see their low back break a little sooner, or into that break into flexion a little sooner. It's really provider preference. I don't think it matters that much. I'm just a little bit picky that I like to see if they can keep their spine flat as long as possible. So for this, Elijah, why don't you go ahead and put your feet into about a shoulder width stance. We're going to standardize this so his toes are straight ahead. So a lot of people have been coached to squat with their toes out. This is normal. I coach it like that too. But that you can't really scale because everyone's got like a different point. So for this, if we put people straight ahead, we know we can standardize this and repeat this every single time between practitioners. It doesn't matter how much toe out their normal squat has because for this test, it is going to be 0. And for me, go ahead and put your arms up overhead for me, and I want you to squat down as deep as you feel comfortable going. So Elijah moves really well. His knees are tracking slightly outside of both of his feet. His back is staying pretty flat. His hip crease is down below parallel. Go ahead and stand up for me. He's not collapsing through his torso. Show us a really bad one. Show me some valgus and some like kind of a collapse. Exactly. He's just kind of crumpling in. He's not doing any of that. Go ahead and turn and face this way for me now. Let's do it from like a profile one. Arms up overhead. Squat down. Great, he's looking really solid here. Maybe a slight little posterior pelvic tilt to that butt wink down there at the very bottom, which as an unloaded movement is totally fine. I'm not too concerned about that. If this was under load, we'd want to be really concerned. But again, this is not abnormal for a basic body weight squat. Depending on what the person's coming in for, it may or may not give you any cues into how they control their spinal position or their body when it comes to some of these more complex movements. But again, it is normal to get a little bit of that, so perfection is not necessarily expected for this. Big criteria: can they control their knee position? Can they more or less control their spinal position? Do they look like they have enough range of motion? Do they look balanced between their feet? Does that hip crease go down below their knees? Those are the big things we're looking for. Okay? So from a basic perspective, those are 7 tests. When you get really good at this, you can go through all of this very quickly. We can add in little things like the active range of motion, flexion and abduction. We can add in like a cervical quadrant testing into our cervical assessments. We can add in a lumbar quadrant testing as well with our multi-segmental testing. So we can really start checking the boxes on some of these orthopedic things while we have them standing. Again, based on what we find, we can either dive into the micro of breaking this stuff out within the SFMA framework and or adding all the orthopedic tests specific to their area of complaint and looking around and see what we can find.